As mentioned, I'm Rafael Benavides, Public Information Officer for the City of Laredo. I am not a health expert, so I don't pretend to be one either, but I have been working with the health department in the city in response to COVID-19 throughout this entire pandemic. So I do have the information. That's what I'll be presenting on today. Let me go ahead and share my screen. All right, and so I prepared a PowerPoint presentation based on some information. I was asked to speak on best practices for reopening your business. For some of you, it's a very difficult situation that many of you are in. I would not wish that on my worst enemy, because you're dealt with two very bad cards. You're dealt with a global pandemic and risking the safety of yourself and your employees and your clients, and then your well-being as well. So it's a very delicate balance, and it's a very difficult decision to make. You've seen that with the council as well, and with the county, and even with the state. You know, we're not always correct in what we do, but we're trying to act as fast as possible to make sure that we value human life above everything else. But we're extremely conscious of the consequences of some of the actions that we've taken, and that includes effects to the economy. So let me give you a little bit of a situation report on COVID-19. Just so everyone is aware, COVID-19 stands for Coronavirus Disease 2019. That is the disease that you get from the virus. The virus is actually called SARS-CoV-2. So here we are in the world. This is from the Johns Hopkins. They have a very good interactive map around the world and for the United States as well. But as you can see here on the left corner, or in the bar, we are actually currently the worst affected country in the entire world for COVID-19. And we probably have, out of all the developed countries, the worst response rate and the worst testing rate out of all the developed countries in the world. A lot of other countries in the developed world don't have access to testing. We don't either. We don't have that many, but it's certainly alarming to see that we have kind of fumbled on this response. At the state level, you can see here from the Texas Department of Health and Human Services, COVID-19 cases. And if you go to the website as well on the dashboard, you can see many different areas. You can see fatalities by county, testing, recoveries, and you can see there Webb County is highlighted. We have a total of 477 positive in Webb County. That's cumulative positive, not currently active, but of course, we have a lack of testing as well. We can't test everyone that we would like to. We certainly cannot test everyone that wants a test, or everyone in the population. And Texas is one of the states that was one of the last ones to implement a statewide shelter-in-place order, and one of the first ones to open up. So that is something to consider as well when you are reopening your businesses or deciding on that. At the local level, if you go to our website, cityoflaredo.com/coronavirus.html, you'll see here, and actually there's an update from the state. So the state had 477, and as of yesterday, we have 479. We'll have a new update today at 12. And you'll see here all the information that we have available to the public. So you can see demographics, breakdown of positive cases by gender. You can see total cases by day, reported by day, and over time. There's a lot of information here. You can also see how many people have called into the hotline. So we do have, compared to a lot of cities, we're a medium-sized city, small medium-sized city in Texas, but we do have a lot of fatalities, and we do have a high infection rate. So that's something also to consider. So new developments for COVID-19. There's been some news about a serious inflammatory condition. I know the Medical Health Authority has been referring to it kind of like Kawasaki disease. That's the only thing that we can refer to it right now, but it's a serious inflammatory condition that may be caused by COVID-19 infection. And we've seen it in a couple of children across the United States, but it's also affecting other people that are not children. So that's something that we're looking into. The changes and developments in the virus is a reminder to all of us, this is not an ordinary respiratory virus. The city and county have taken extraordinary measures to minimize risks to the public, because the risks are very real and they are serious. So this was never about civil liberties. This was never about imposing, extra restrictions on businesses. It's always been about public health and for safety of the public, and those are very difficult decisions, as I mentioned before. And studies are being done on possible vaccines currently and antibody therapy. Currently, there's no vaccine, there's no cure, there's no treatment. And for those who have recovered, they do have antibodies, but we're not even sure at this point if they can be reinfected. So this certainly is a novel virus, and everyone all over the world is trying to study it. So Governor Abbott, as I think Cesar or Luis mentioned earlier, he did have a press conference yesterday. He announced some new measures to open up Texas. So yesterday he announced the second phase to open Texas and provided an updated list of what types of businesses and activities can resume and when. So as you all have probably been following, I'm sure, the City of Laredo and the county issued a order before the state, and that was simply because the state hadn't issued a statewide order yet, and we felt it was necessary to do that to protect our citizens. So we had it first, and we issued out a couple of restrictions on certain types of restaurants or certain types of businesses. Essential businesses, we had outlined what was essential, what was not essential. We implemented a curfew, and slowly but surely the governor has and the state have come on board, and they've issued out their own orders. And as they do, we have to actually follow those. So local entities have to follow the state orders, and states have to follow federal orders. So that's where we are right now. So the governor has kind of opened up by June 1st. He pretty much will have opened up everything except for, from what I understand, gambling and sexually explicit businesses. So on May 18th, which is yesterday, gyms could open and exercise facilities, hair salons and barbershops, non-essential manufacturers and other offices, massage and personal care businesses, which includes tattoos or tattoo shops and piercing studios, laser hair removal, hair loss treatment, child care centers. Those were immediately available upon the announcement yesterday. They were able to open up. Youth clubs, and on May 22nd, we'll have 50% capacity for restaurants. That 50%, or currently right now 25% capacity, is only for indoor dining. If you have an outdoor facility, that capacity does not apply to you, but you still have to follow social distancing or physical distancing requirements. Bars will also be able to be opened up. Tasting rooms and other establishments at 25% capacity. Bowling alleys, bingo halls, skating rinks, and simulcasting, which I've been told is gambling, a form of gambling. Rodeo and equestrian events. On the 29th, the zoos will be able to open up. On the 31st, professional sports without in-person spectators, and day and overnight youth camps and youth sports will be able to open up. And finally, on June 1st, the governor has said that school districts can hold summer school if they are following social distancing guidelines, but students are not required to attend in person. If they wanted to attend virtually, they can do that. And of course, you can get more information on the state website for opening up Texas. It's gov.texas.gov/organization/open Texas. So just to give you guys an example of what I do and what we've been doing at the city and at the local level, this is crisis management. We're certainly in a crisis, and we've activated the Emergency Operations Center. Chief Steve Lundin just retired. We have our interim Emergency Operations Manager is currently Chief Ramiro Elizondo. But usually there's a tornado, there's a hurricane, there's something happening. It might even be an active shooter situation or something. But we have a plan in place to make sure that we respond to it. We respond to those who are injured, and there's an ending or a timeline that we can kind of hypothesize. In this case, there isn't. We don't know when anything's going to stop. We don't know when things are going to get better or worse. They can be flare-ups. This can last on for years. So it's really difficult for us to kind of come up with a timeline on this. So as you can see here, we've kind of followed, this is what a lot of us have been following all over the country for crisis management. And that boom area, the slow roll crisis, there isn't a moment really where you can say, okay, you know what, it's fine, we can open up now. We can open up all businesses, all entities, all establishments. We're trying to do it in waves so that we control the mitigation of the transmission of the disease. But again, it's very difficult. Some states have certainly started before others. I think all health experts agree that it is too early to actually begin opening up in mass. So we're doing that in waves. But we do understand that people need to get back to work, and people have been demanding to go back to some sense of normalcy. So we're trying to do that in the best way possible while maintaining some level of safety. So as you're thinking about reopening your business, because you are now allowed to, as per the governor, there's a couple things you might want to keep in mind. Risks. So there will be risk to your employees, and the risk to your employees will likely be greater than the risk to your customers. Mitigation. The degree to which mitigation is possible will vary by setting. So for example, if your clientele tends to be part of the vulnerable groups, so those who are overweight, obese, who are older, those who have compromised immune systems, they will be at a greater risk for catching the disease. And then the economy, as you all know here, being on the border, having a business on the border, our economy is extremely interwoven with not only resuming local activities here in Laredo, but those of our international tourists. And tourists are currently still forbidden to come into the United States. There's restrictions on tourist visas from Mexico, and the other way around, I should say. So all of these retail establishments, a lot of the restaurants, they depend on them, and they currently are not able to come over, so that's going to be difficult. So it may be a long process before things start to pick up and feel a little bit better. You're going to have to be creative, but you're always going to have to be safe. So how to reopen safer, and I put those in quotations because certainly it's not safe, but it is safer. The safest thing would be to shelter in place, but we can't do that. We can't do that forever. We have to open up in phases like we had mentioned before. So the first step is to engage. You want to engage your clients throughout the process. Let them know what's happening. If you are closed, if you have a difference in hours, if you're doing things differently, now you're having curbside or everything's online, or you're taking only card payments, or why you decided to do that. You always want to maintain a level of communication with your clients. Deciding, so you have to decide, in deciding if you should open, conduct an employee and client health risk assessment. And then start slow. So start with low risk activities to mitigate risk and proceed from there. Opportunities to engage the community. So you have a couple of opportunities here. You have decisions to make, the decisions on how and when to reopen. You have to discuss that with your stakeholders. Actions individuals and businesses can take to prevent transmission. So you might want to say, for example, in order to come to our business, you have to wear a face mask. Or for example, if you're a gym and you're going to have a yoga session, if everyone's bringing in the yoga mats, then they have to disinfect them at the door. I know some places like here at City Hall, for example, we're still closed to the public, but even all employees, as soon as we come in, we're all checked with a thermometer, not in our tongue, but it's one of those digital thermometers that they can just, kind of put against your forehead, not touching it. And if anyone comes out with a fever, or if they present any symptoms of being sick, then they are sent home. That might be a good practice for you all to put in place for your employees and for your clients as well. Expectations. What to expect in the coming weeks, months, and years. You have to really plan that. So for example, in the city, we depend a lot on, of course, one of our only ways of getting revenue is through taxes and through sales tax. We're currently in fiscal year 2020, and this has certainly affected us, and it's going to affect us for several years, but it's really not going to, it's going to affect us horribly next year in fiscal year 2021. So you're going to have to plan for that. We're planning for that as well. We're not laying off any people yet, but I know some cities have laid off hundreds of people. I know there's certain activities that we're not doing anymore. We're not funding certain projects. You'll have to decide that as well. If you're going to lay off people, if you're going to provide the same services, plan not only for next week when you're able to open, but plan for months and years ahead, because this will be a long-term, this will have long-term effects. public health risk assessment. So your goal should be to assess the risk of increased transmission in each sector to prioritize reopening. There are factors influencing risk such as contact intensity, number of contacts, and mitigation measures. How to make your business safer. So these are a couple of steps, and it's an inverted pyramid. So the one at the very top is probably the most important. So physical distancing. We say physical distancing as opposed to social distancing because during this time we realize a lot of people have, when you're isolated and you're alone, and we're social creatures, obviously we've evolved to be social. There's a lot of anxiety, there's a lot of depression, there's a lot of mood disorders going on right now. So we want to remind people that be physically distant, but socially strong and socially connected. So we tend to use that word more often than social distancing. It means the same thing though. So practice physical distancing, have administrative controls. So have controls in place to make sure that you have your employees that are not interacting so much with the public, and other controls in place, PPE, personal protective equipment, so masks. I know some people use the plexiglass shields for themselves, and on the drive-thru, for example, when dealing with customers, they have that barrier. Or when they come in as well, even at City Hall, if you are allowed to come in for an appointment or for whatever it may be, you'll see that the receptionist has an entire area at her desk where it says it's a plexiglass shield. So creating some barrier between the customers come in. So here's some examples of risk assessments. You can refer back to the Open Texas Handbook. That's from the governor. That's on the state's website. And also a really good website to go to is backtoworksafely.org, and that covers pretty much every single type of establishment or business that you can think of. So here are just some examples. For example, a category of restaurants, contact intensity, how much contact people usually have at restaurants. It tends to be medium. And this is all from Johns Hopkins University, the School of Public Health. The number of contacts as well as medium, modification potential, medium, and the mitigation resource. So this is where you get the information as to how to reopen safely and get the instructions on how much distance or what precautions to take. So here you would look at the National Restaurant Association, the FDA, and the governor's office. And I'm just referring to Gov because I don't have a lot of space in this bar. So whenever I put GUV, I'm referring to Governor Greg Abbott's office. Bars. The very nature of and setting of bars is, everyone's kind of close together at a bar. They're close to each other, they're mingling, they're talking, they're drinking. They usually don't have a mask because they are drinking, so it's going to be high. So there's a high chance of transmission. Contact intensity is high, number of contacts is high, modification potential is medium. This is for your plan, for your business as well. And the mitigation resource would be, of course, the FDA and also the governor's office. And he lays out a bunch of plans. So if you go to the governor's Open Texas Handbook, you'll see there's an actual check sheet or a checkoff guide, I guess, where you can kind of make sure you're taking all the precautions to open up safer. So salons, spas, and personal care, same thing. Medium, I should have put medium, medium to high, low for a number of contacts, modification potential is medium, and then mitigation resource would be the governor's office, and so on and so on. Mitigation, limit the number of interactions between employees, customers, and or clients, especially sustained interactions. So you have a much higher chance of getting being transmitted with COVID-19 or the virus that causes COVID-19 if you have sustained contact or sustained interaction with someone. So just passing by through someone, it's a low chance that you're going to get COVID-19 from them. But if you were sitting down with them, talking with them, interacting with them, exchanging objects, money, whatever it may be, the longer you're doing that, there's higher chances of getting or transmitting the disease. So possible considerations for you at your establishment. Maybe you want to require everyone to wear a face mask. That is completely up to you. The governor has made it voluntary. So even though the city does highly recommend it, it is pretty much still voluntary at this time. So, but as a private business, you can refuse service for anything so long as it's not an illegal reason in terms of discrimination. But you can certainly say no mask, no service. So that's up to you, and if you want to protect your employees and, of course, the customers that come in as well. So you might want to switch to disposable menus, maybe using paper or just simple Xerox copies of your menus. That way you can, when you're picking up the table, you can just throw the menus as well, instead of having those thick laminated menus that, you know, people tend to hold and get food on and touch, and they're just doing that, you know, several times a day. This is a very contagious and disease, and it's very serious as well. It can be fatal for many people. So disposable menus is definitely a good option. You probably want to switch to, you want to switch transactions to maybe online only, or go cashless. Dealing with cash is another vector for possible transmission of the disease. There's a lot of germs in handling cash, whether it's coins or bills. But that being said, a lot of our customers tend to, on the border, sometimes they don't have banks, or sometimes they're tourists from another country, so they tend to like cash more than a card. There's several reasons for that. So if it makes sense for you, you might want to go cashless. Maybe just only take cards, or you know, you can do phone pay, Apple Pay. I know, for example, I just got my Burger King breakfast this morning, and they had the plexiglass on the drive-through. They had the mask. I had my mask as well, and they had a plastic tub. So when I was going to pay with my card, and I literally dropped it into the tub, and they got it from there. So they didn't even have a chance to touch my hand or anything. So they're definitely taking proper precautions on that. But again, it's whatever makes sense for you all. You might want to limit the number of employees who handle the transfer of objects like food or transactions or products and customers. So instead of having, you know, 3 hostesses for your restaurant or whatever, maybe you just want to have 1, or maybe have 2 but with longer shifts. You want to encourage alternatives to the indoor experience. So if you are, I know I'm using a lot of examples of restaurants, but if you're a restaurant, maybe you want to have outdoor or do drive-through or pickup delivery. And of course, being outdoors, you're not subject to the same 25 or 50% capacity rule. And it's probably good to get you know, fresh air in there as well. So if you're outdoors, it probably would be safer if you're following the physical distancing guidelines. So the plan, you will have to come up with a plan for your own business. So draw up a plan and decide how you will integrate these considerations at your business. Explain to the customer what the new procedures are and why they are needed. So you might want to say, for example, we're implementing these new policies or procedures to protect you, or because we care about you, we care about your well-being. Don't just say because it's, you know, it's mandated by the state or the local government or whatever it may be. That's not good customer service. And when someone asks you, why do I have to wear a mask? It's, you know, probably not going to end well if you just say, because they're making us do it, so we're making you do it. You want to kind of polish it a little bit differently for your customers. People don't like being in the dark with regarding information, and just being told to do something without an explanation doesn't really go well with them. So here's an example of something that we have on our website, and we're encouraging businesses and establishments to use it. You can use it on your front door, paste it, or put it with tape. Before you enter, you can say, you know, no mask, no entry, same as in Spanish. And it's an official guidance from the City of Laredo as per one of our ordinances. You can download that on our website as well. And I'll provide all the information and links to the MileOne staff. So we've all heard this term before, evolve or die in business. So times change, and your business model needs to be able to adapt and change with the new trends and situations that are happening. So maybe try reducing the number of objects moving between employees and customers. What does that mean? So for example, again, another example of a restaurant that's probably all I could think of when I was writing this, is, for example, instead of sharing the same ketchup bottle, right? Where people from different, you don't know where they've been, and this is of course a highly contagious virus that can live on surfaces. So instead of having that ketchup or mustard bottle or syrup bottle, whatever it is, use individual packets. Give it to them. That way they can leave it on the table and you'll throw it afterwards. You're lessening the chance of spreading the disease. Move part or all of your business online, if that makes sense to you. For example, if you're a marketing firm, you know, you don't necessarily need to see clients in person. You can do stuff over Zoom or over the phone sometimes. I know a lot of doctors have been doing telemedicine. Psychiatrists, psychologists, they're able to continue their work through online methods, and it hasn't caused any issues for them. And sometimes it might even be better because you can do it from the comfort of your own home, and the customer may enjoy that as well. If possible, enable employees to work from home. It doesn't work for everyone. Some places you need to have employees there at the work site, but if you're an office type setting, and they're just there to kind of really type stuff, and they have a computer at home, maybe that you provided or that they have on their own, and they want to work from home, give them that option. That might work better for everyone. And of course, you're lessening the chances of people being congregated in the same place and lessening the chances of the transmission of the virus. Alternate employee shifts so that the same group of people are exposed to each other. You want to make sure that when people are coming in, that they are being exposed to the same group of people, not different ones. So that might mean you have to create longer shifts to reduce the number of employee changes. But what you don't want to do is have, for example, John and Mary, whoever your employees are, come in, and work a whole week of shifts, and every single day they're with different people, because you don't know where they've been, you don't know where those other people have been, and you're increasing the chances of the virus spreading. So it'd be much better and safer if you create groups where people will have their shifts. Maybe it might be longer, but they're together throughout the whole weekend until things get better. Limit in-person interactions. So you might want to tell your customers, instead of coming in and waiting to be seated or to have an appointment or whatever it may be, call ahead or order online or use your app, etc. All right, so that is it for the PowerPoint presentation. If you have any questions, I'll be here to answer them. I want to give out some useful information as well. So here's the coronavirus hotline for the City of Laredo Health Department. That's 795-4954. It is available Monday through Friday from 8 a.m. to 5 p.m. And then I'll provide links to the MileOne staff as well for an operational toolkit for businesses. So if you're someone that really wants to take this seriously, there is a bunch of free research and information, and there's an actual work book that you can get from Johns Hopkins Bloomberg School of Public Health, Center for Public Security, and they will tell you exactly how to draft up that plan. And so you can see if you are at a higher risk, low risk, medium risk for reopening for both your employees and for your clients. And you can make a very educated guess or decision based on that. The Governor's Strike Force to Open Texas, that's a very good tool as well. That's basically telling you what you can and cannot do in Texas, including Laredo. Back-to-worksafely.org is a wonderful site. So no matter what type of business you have, there's guidance there from many different reputable sources. And of course, City of Laredo is available for information as well. So at this time, let me go ahead and end the screen sharing, and I'll pass it back over to either Cesar or Luis from MileOne.
Thank you very much, Rafael. Great information. I think very detailed in terms of what can and cannot be done. I have a couple of questions here from some of our participants. Question from Mr. Ibarra. My company does door-to-door knocking and in-home sales. What would you suggest as we proceed forward?
So I was just talking with the census yesterday, and they've completely redone their whole modeling because they used to go door to door to remind people about the census, and they're not comfortable doing that. They will start to do that maybe towards June when things might get a little bit better and as a last resort. But door-to-door knocking is certainly not, I wouldn't recommend it because one, you're exposing yourself to people that you don't know. And again, this is a very contagious disease. And second, the people that are going to be greeting you at the door, it's not the same environment as it was a couple months ago. So they're not going to be greeting you or opening the door with, being inquisitive or like, what are you selling? They're probably going to meet you with some type of hostility saying, what are you doing at my door? People are scared, they're at home. They don't know what who to trust sometimes. So with this virus, so it's probably not, that wouldn't be my recommendation, not to do door-to-door sales. If that was your business before, then you have to probably be creative and maybe you want to create a website. Everyone's online now, so sometimes you can go on different times of the day and the internet will be slow because there's so many people using it, and that's to our advantage. So sometimes you can, if you haven't done it before, if you were just doing the traditional door-to-door sales type of stuff, now maybe convert that to, at least temporarily, online, invest in a great website, have interactive, be interactive with your clients on Facebook, on Twitter, on Instagram. That's where people are. So people are still available. They're just not maybe opening their doors in person, but they still are as available as ever before.
Thank you, Rafael. Question from Ms. Gonzalez. If someone gets sick and it turns out to be positive, what are the steps to follow before CDC or the city?
So if someone is turns out to be positive, either at your place of employment or at home, that needs to be reported to the health department, and it will be. So regardless if you get tested at a private health clinic or at the hospital, the health department will be notified. So they will be in contact with you actually to let you know what you need to do. So for example, if someone gets sick at your place of employment, and even if they don't tell you, they just say, boss, I feel sick, I'm gonna go home. You say, okay. And they end up getting tested later on by their doctor, and they're positive for COVID-19. That gets sent directly to the health department. Health department does contact tracing investigations. So they start talking to the person who was positive, who have they been in contact with, who lives in their household, where do they work, and they will literally contact everyone. So they'll contact the employer, they'll contact the family, they'll contact friends, they'll contact that gym that they used to go to, whatever it may be. So you will be contacted by the health department.
All right, I got another question from Ms. Gonzalez. Where or with whom do we go for employee rights and benefits?
So you should go to the Texas or South Texas Workforce Solutions. Texas Workforce will be the person, the state will be the entity to give you guidance on unemployment and benefits. Unfortunately, that kind of ran out real quick. I know that the federal government is trying to work to pass another stimulus bill, if they haven't already passed it, to provide more benefits for people. But yes, you have to contact Workforce Solutions and the state to get some type of unemployment benefits. Sometimes even if you're, this is really difficult actually, because what's happening now, not only at the state level with the governor's office, but actually with at the federal level with the president, is that even if you're a vulnerable person, you might have been able to say before, I can't work because I have a compromised immune system or whatever it may be, so I want to claim unemployment. Slowly but surely, we're seeing that those kind of benefits are being chipped away at. So now what's happening is that the state and the federal government is saying, well, you don't have to pay a person unemployment. They don't have to go back to work, but you don't have to pay them if they don't want to. So then people are really forced to go back to work and forced to risk themselves sometimes. So you definitely want to have something in place where you're talking, you're having good communication with your employees and your customers as well. But your employees should not feel that their health is being risked and they're being forced to come back to work. You want to explain that you're taking all the precautions necessary to protect their well-being.
Next question from a private message from Mr. Lascari. Does expectation planning include return to a shutdown? In other words, has there been a trigger point identified for a possible return to a shutdown?
Yes. So if when things open up and people start getting sick and there's a huge flare-up, that's exactly what will happen. We'll have to have another shutdown, and it's happened to other countries as well. So if you can do this right, but if you don't, then the only other option, because again, there's no cure, there's no treatment, there's no vaccine. The only protection that we have is to shelter in place. So if there's a huge flare-up again, then yes, we will have to go back to shelter in place and closing certain entities.
I don't see any other questions coming in. Does anybody have any other questions or comments? I just wanted to just also remind everybody that MileOne is here to assist with strategy sessions or informational sessions of any sort. We have gone, we are helping and assisting businesses get online to kind of go into in respects to the retail to go and the curbside pickup. We can assist businesses in developing a Shopify website. There is several agencies out in the community that can help you as well, but we offer that strategy session free of charge, and we'll put up our website shortly. I want to thank everybody for joining us today. I just wanted to one more time ask if anyone had any other questions. I want to thank everybody. Rafael, thank you very much for joining us. We greatly appreciate your time and your due diligence, what you've been doing for the city, and just informing everybody on how to open up safely, because we do understand that the economy does need to move forward, and we trying to get back to some normalcy. But we thank you very much for your hard work and the city's hard work in putting this together. If there isn't any other questions, I want to thank everybody for joining us today. Please keep an eye out for other webinars and informational sessions that MileOne will be putting out. Thank you, and please have a wonderful day and stay safe.
Thank you. Great job, Rafa. Good information.
Thanks for having me.
Take care, everybody.
Thank you, MileOne.